Picture this. You come home after a long day. You open the front door and your dog is right there. Front legs stretched forward, chest low, rear end up in the air. Tail moving, eyes on you. And you smile. Of course you do. You think, he's so happy to see me. And maybe he is. But here's the thing I need to tell you, and I need you to really hear this. That exact same position, front down, rear up, can mean one of three completely different things. And two of them are fine, but one of them is a medical emergency hiding in plain sight. I'm Dr. Sean McKenna. I've been a practicing veterinarian for over 20 years, and I cannot count the number of times an owner has sat across from me in the exam room and said some version of the same sentence. He seemed fine. He just kept stretching in a weird way. By the time they said those words, their dog was already seriously ill. Today, I want to make sure that never happens to your dog, because the difference between a happy stretch and a pain signal is not obvious, not at first glance. But once I show you what to look for, you will never unsee it. So stay with me. This one matters. Here's something most dog owners don't realize. When your dog drops into that chest down, rear up position, they are not doing one thing. They are doing one of three things. And those three things have almost nothing in common except the shape. Think of it like this. If someone sent you a text that just said, "I need you," that message could mean a dozen different things, depending on who sent it and what was happening in their life. The words are identical. The meaning is completely different. Your dog's stretch works the same way. Same posture, three entirely different messages. I call them the love stretch, the play stretch, and the pain stretch. Most dog owners know the first one. Some know the second. Almost nobody, until something goes wrong, knows the third. By the end of this video, you'll know all three, and more importantly, you'll know the specific physical signals that tell you which one you're looking at in real time. Let's start with the good ones. You come home, your dog sees you, and they do a slow, deliberate, almost ceremonial stretch. Front leg sliding forward, chest down, a long exhale almost built into the motion. Then they come right to you. That is what I think of as the love stretch, and it's exactly as beautiful as it looks. Here's what's actually happening. When your dog has been resting and then suddenly something they love appears, you in this case, their muscles are still warm from sleep, their nervous system lights up, and they perform what animal behaviorists call an affiliative bow. It's a full body way of saying, I am completely comfortable with you. You are safe. I am happy. Dogs have used this posture with other dogs for thousands of years to signal peaceful intent. The fact that your dog now uses it with you means you have become, in their mind, someone worth communicating with, someone worth greeting properly. Here's how you identify it with confidence. The love stretch is slow. It is unhurried. The dog is not bouncing or pawing. They lower themselves almost like they're savoring the movement. Their face is relaxed, mouth soft, sometimes slightly open, eyes gentle and half-lidded. Their tail wags, but it's a loose, easy wag. Full sweeps. Their whole back end might even sway with it. And critically, once the stretch is done, they move toward you. They're done stretching. They want contact. The correct response. Meet them where they are. Crouch down if you can. Let them come to you. Place your hand on their chest or their side, not over their head. That kind of low, calm greeting matches the energy they just offered you. You're speaking their language back to them. This is the stretch most dog owners picture when they think about their dog's morning greeting. It is one of the most genuine displays of trust in the animal world. Recognize it. Honor it. Because your dog does not extend that kind of greeting to everyone. Now let's talk about the second stretch, because this one gets confused with the first one constantly, and the confusion is completely understandable. You're on the couch, your dog walks in, and suddenly, bam, front end drops, rear end up, tail going like a helicopter. They might bark once, they might bounce, they might run 2 steps toward you and then back up, still in the stretch position. That is the play stretch, and it is completely different in energy and intention from the love stretch, even though the posture looks similar. What your dog is doing here is issuing a direct invitation. Animal behaviorists and trainers have studied this posture for decades, and the consensus is clear. It is one of the most unambiguous social signals dogs have. It translates almost word for word as, "I want to play with you right now. Are you in?" Here's how to tell it apart from the love stretch. The play stretch is not slow. It's quick and bouncy. Your dog may pop in and out of the position. Their eyes are wide and bright, not soft and sleepy, but alert and sparkling. Their mouth is often open with short, excited panting. Their tail wags fast, sometimes in tight little circles rather than long sweeps. Their whole body has an electric quality to it, like they're barely containing themselves. Most importantly, the play stretch is directed at you with a kind of theatrical urgency. They're watching your face for a response. They're essentially waiting for you to say yes. And honestly, when you can, say yes. Get on the floor, grab a toy. Even a 30-second burst of play has real value for your dog's mental health. Research consistently shows that dogs who engage in regular interactive play with their owners show lower rates of anxiety and are more responsive during training. That play stretch is an invitation to connect. It costs you almost nothing. It means the world to them. When you can't play right then, that's okay too. A calm but warm acknowledgement, "Not right now, buddy," with a gentle scratch behind the ear tells them you saw the invitation. You're not ignoring them. You'll come back to it. So, love stretch, play stretch. Both are healthy. Both are good. Both are your dog communicating something positive. Now we get to the one that keeps me up at night. Let me tell you about a dog named Biscuit. Biscuit was a 7-year-old miniature schnauzer who came into my clinic on a Tuesday morning. Her owner, a woman in her 50s who had raised dogs her whole life, had noticed that Biscuit kept doing what she described as that deep stretch. She thought Biscuit was excited because they had company over the night before. She wasn't worried. She almost didn't call. What I found when I examined Biscuit was pancreatitis, inflammation of the pancreas, that had already progressed to the point where she needed IV fluids and hospital care for 3 days. Biscuit recovered, but her owner told me afterward, "I sat there watching her stretch all evening. I even took a video because I thought it was cute." I've heard versions of that story more times than I can count. Here's what the pain stretch actually is and why your dog does it. The pancreas is a small organ that sits tucked in the upper abdomen, right next to the stomach and the small intestine. Its job is to produce digestive enzymes and help regulate blood sugar. When it becomes inflamed from a high-fat meal, from obesity, from certain medications, sometimes for no identifiable reason at all, those digestive enzymes activate too early. Instead of traveling to the intestine to do their work, they begin breaking down the pancreas itself. The pain this causes is severe. It's been described in human patients as one of the most intense forms of abdominal pain there is. Your dog cannot tell you that. They cannot point to where it hurts. So their body does something instinctive. It tries to redistribute the pressure. By lowering their chest and extending their front legs while keeping their hindquarters raised, they are physically shifting their abdominal organs away from the area of inflammation. They are trying, in the most primitive way possible, to find a position that hurts less. It is not a stretch. It is a coping mechanism. And the tragedy is that it looks almost identical to the love stretch and the play stretch from across the room. Pancreatitis is one of the most common reasons I hospitalize dogs. Certain breeds are more predisposed. Miniature schnauzers, cocker spaniels, miniature poodles, but it can happen to any dog at any age. Treatment can range from a few $100s for mild cases to several thousand for dogs who need intensive care. And if it goes unrecognized and untreated, it can progress to shock. In the worst cases, it can be fatal. Pancreatitis is also not the only condition that produces this position. Gastrointestinal obstructions, stomach ulcers, liver and spleen problems, all of these can cause the same instinctive response. The pain position is your dog's body telling you that something inside is very wrong, which means you need to be able to recognize it, and you can if you know what to look for. Here is the clinical framework I use, simplified for real life. When you see your dog in that front, down, rear up position, run through these 4 checks. It takes about 10 seconds. It could save their life. Number 1, how long does it last? A love stretch is brief. It rises and releases like a wave. A play stretch is bouncy, in and out, full of movement. But the pain stretch is held. The dog locks into it and stays there, sometimes 30 seconds, sometimes longer. Sometimes they lower out of it and then return to it again a few minutes later. Duration and repetition are the first red flags. If your dog stretches once and moves on, you're almost certainly fine. If your dog stretches and holds, or stretches, stops, and stretches again, stay alert. Number 2, what does their face look like? This is where the difference becomes undeniable once you know to look for it. In the love stretch, the face is soft, relaxed jaw, gentle eyes, maybe a slow blink. In the play stretch, the face is bright and wide-eyed, almost grinning. But in the pain stretch, the face is tight. The eyes are not soft and not playful. They have a fixed, slightly glazed quality. The jaw may be tense. The dog may be drooling slightly, which is a sign of nausea. The ears are often slightly back or pinned, which is a stress signal. Look at the face. The face doesn't lie. Number 3, what happens when the stretch ends? After a love stretch, your dog comes to you. After a play stretch, your dog bounces and invites you to engage. After a pain stretch, your dog typically does one of 2 things. They stand still and look uncomfortable, or they lie down very carefully, as if lowering themselves hurts. A dog in pain does not transition smoothly into normal dog behavior. They may stand in one place, looking at you or at the wall, without the follow-through of a dog who is simply glad to see you. Number 4, is anything else off? This is the most important check of all because the pain stretch rarely travels alone. Has your dog eaten today? A dog in abdominal pain often stops eating entirely, sometimes within hours of the pain beginning. Have they vomited? Even once is worth noting. Are they less interested in their surroundings than usual? Quieter, slower to respond, not seeking you out the way they normally do? Is their abdomen visually swollen or tense to the touch? Any one of these alongside a repeated, held stretch is reason to call your vet. Multiple symptoms together constitute an urgent situation. Vomiting more than 3 times in a 24-hour window, or any signs of extreme weakness, pale gums, or inability to stand comfortably means you go to an emergency clinic now. Not in the morning, now. If you have run through those 4 checks and something feels wrong, here is what I need you to do. First, do not push on their abdomen. I know the instinct is to check, to feel, to reassure them with touch. But if your dog is in abdominal pain, pressure makes it worse, and a dog in enough pain may snap even at someone they love deeply. Keep your hands gentle and away from the belly. Second, do not offer food or water until you've spoken to a vet. Eating stimulates the pancreas to produce more digestive enzymes. If pancreatitis is the cause, feeding your dog can accelerate the inflammation. Offer them a quiet, comfortable place to rest and get on the phone. Third, do not give human pain medication. I need to say this clearly. Ibuprofen and acetaminophen, Tylenol, Advil, anything in your medicine cabinet are toxic to dogs. Even a small dose can cause kidney failure. There is nothing in your bathroom that will help your dog right now, and several things that could seriously harm them. Fourth, call your vet and describe specifically what you observed. Tell them how long the stretch lasted. Tell them if it repeated. Tell them whether your dog has eaten, whether there has been any vomiting, and how their energy level compares to normal. The more specific you are, the faster your vet can triage the situation. If your vet's office is closed and symptoms are progressing, go to an emergency animal hospital. Bring notes if you can. If you took a video on your phone, please take a video on your phone and show it to the vet. A 30-second clip of your dog's posture and behavior can communicate more than 5 minutes of description. If your dog is diagnosed with pancreatitis, here is what the road forward typically looks like. Mild cases may be treated on an outpatient basis with medication to manage pain and nausea. More severe cases require hospitalization, usually 2 to 4 days of IV fluids, pain management, and careful reintroduction of food. Most dogs with mild pancreatitis recover within a week or 2. Severe cases take longer and carry a more uncertain prognosis, which is exactly why early recognition matters so much. Once your dog has had pancreatitis, dietary management becomes a permanent part of their life. A low-fat diet is the cornerstone of long-term prevention. And I want to be specific here because low-fat sounds simple, but it's not always obvious in practice. Table scraps, especially anything fatty like sausage, bacon, buttered bread, or cooking oils, are off the table permanently. I've seen dogs come back to me in crisis after a single Thanksgiving dinner. High-fat foods are one of the most consistent triggers we know of. Ask your vet about a prescription diet formulated for gastrointestinal support. Over-the-counter, low-fat options vary widely in their actual fat content. A vet-recommended diet gives you a known, consistent baseline. Weight management matters too. Overweight dogs carry a meaningfully higher risk of pancreatitis. If your dog is carrying extra weight, talk to your vet about a gradual, safe weight loss plan. Regular, moderate exercise, daily walks, consistent activity supports healthy body weight and better overall organ function. And finally, monitor. Once you have seen a dog go through pancreatitis, you will never look at a stretch the same way again. That vigilance is not anxiety. That vigilance is exactly what your dog needs from you. I want to say something directly to you before we close. If your dog has done that stretch before, if you've seen it and smiled and thought, oh, he must be excited, I don't want you to feel guilty. I mean that. The love stretch and the pain stretch look nearly identical to someone who has never taught the difference. This is not common knowledge. It is not something most pet owners are taught, and it is not your fault that no one showed you. What matters now is that you know, and that knowledge is a gift, not just for a crisis, but for every ordinary day. Because once you learn to read the difference between those three stretches, you're not just watching your dog, you're listening to them. You are building a kind of fluency in who they are and how they communicate, and that changes everything about how you live together. After 20 years in this profession, I can tell you with complete certainty, the dogs who do best are not always the ones with the most expensive food or the most elaborate toys. They are the ones whose owners pay attention, who notice the small things, who trust their gut when something seems off. You are already that kind of owner. The fact that you're here, watching this, thinking about your dog right now, that tells me everything. So here's what I want you to take away today. Your dog has 3 stretches. The love stretch is slow, directed at you, followed by calm contact. The play stretch is energetic, bouncy, and an invitation to engage. And the pain stretch is held, repeated, and accompanied by a tight face, a change in eating or energy, and often nausea or vomiting. Run the 4 checks: duration, facial expression, what comes after, and whether anything else seems off. If you're unsure, call your vet. That's what we're there for. The one thing I want you to remember above everything else, the same position can carry 3 completely different messages. Context is your decoder. Your dog is always talking to you. The more fluently you can listen, the safer they will be. Now I want to hear from you. Does your dog do a big stretch when you come home? Have you ever wondered if it meant something different? Leave a comment below and describe it. What does your dog look like when they do it? I genuinely read these, and sometimes a detail in the comments is exactly what another dog owner needed to hear. If this helped you see your dog a little more clearly today, please hit the like button. It helps this channel reach other dog owners who might need this information before it matters. And if you want to keep learning how to read your dog, not just their behavior, but their body, their health, their signals, subscribe. That's what we do here. No hype, no drama, just real veterinary knowledge explained in plain language so you can be the owner your dog deserves. I'm Dr. Sean McKenna. Thank you for being here. Give your dog a scratch from me.